Hello, my name is Billy Yagan, SPTA, and I had case study 13.1. In this case study, a 60-year-old female that's in the ICU who underwent open heart surgery for the replacement of the mitral valve 2 days ago. The point of this case study is that she has been referred to physical therapy for postural drainage, pulmonary hygiene techniques, and bed mobility exercises. So it's stated in here that after the PT evaluates, it'll be the PTA's job to teach the patient all of these different exercises. So first we need to know what the mitral valve is. It's a valve that's also called the bicuspid valve, and it prevents the backflow of the blood from the left ventricle into the left atrium. And it's anchored in by the chordate tendineae. Just a few reasons of why you would need this replaced is stenosis, insufficiency, and the prolapse. So next it talked about postural drainage. What that is it's achieved by placing patients into a position such that the bronchial segment of the lung will drain with the aid of gravity into the larger bronchi, where the lung secretions can stimulate a cough reflex and to be exportated. What I'm going to do today is try to teach you how to do that. So you're going to make kind of cups out of your hand, and you would place the patient. So if, let's say that the drainage is in the very bottom of their lungs, you would place the patient in a Trendelenburg position, and you would cup your hands and do rapid movements. And that's going to push that fluid into bigger bronchioles that is going to stimulate that cough reflex. So my first time in the ICU, I was very overwhelmed by how many lines and tubes and everything there was. So just to try to get you more acclimated, here are some considerations that the PTA would need before entering the patient's room. First thing, before you even walk in, you would ask the nurse if any status has changed and if physical therapy is still able to work with them. A main thing is to keep the lines untangled. That is very important. The catheter needs to remain below the waist so everything can be drained. You want to make sure the IV line is not occluded or pulled on. If it's pulled on, of course, there could be blood, and then you're just going to mess things up. If that does happen, contact nursing, place the patient in a very comfortable position. The oxygen needs to remain on the face securely, whether it's the nasal cannula or the face mask. Just to ensure that the patient receives the correct amount of oxygen. Keeping the O2 stat between 85 and 100, that's very important. Having an object for the patient to spit the sputum in once they cough up from the postural drainage. And then also it's important to check that dressing and drainage, which was a part of the case study that I didn't read. So you just want to try to check the dressing that's on there to make sure there's no excess secretions or anything, and just make sure that it is looking good. The infection control precautions that you would need to follow is for the catheter, just be sure to use gloves. Everything, actually, you're just going to want to use drugs for the chest drainage and for the dressing. Gloves help keep yourself from acquiring infection, but also helps the patient to not receive more infection. The next thing is to identify the appropriate action of the PTA if the cardiac monitor electrodes displaced during treatment and the alarm sounds on the monitor. This actually happens quite a bit in the ICU, but what you would want to do is just place the patient into a very comfortable position. Do not try to put the pads back on. We're not trained in that, so that's really not our forte. So what you would do is you'd put the patient in a comfortable position, and then you'd go contact nursing. If you put the pads on the wrong spot, it could get a false reading, either freak the heart people out, or make sure it may seem like everything's okay when it's really not. So just be sure to notify nursing. And if I were to explain the physical therapy procedure to the patient, I would talk in terms to where they would understand it, not where I leave the patient more confused than when I even walked in the first place. So what I would say is physical therapy is important after open heart surgery for many reasons. These can include postural drainage, bed mobility, as in moving around in the bed, personal hygiene techniques, transfers, and some ambulation, which is also known as walking. Postural drainage is necessary because it is intended to get whatever is in the lungs that isn't supposed to be there out, such as any sort of liquid. I would tell the patient that I would place them in a position that gravity will assist them while I'm performing some percussions on you and pushing the fluid to a place that tells your brain to cough to get the bad stuff out. And the percussions that I'm talking about is what we did earlier with the cupping and pushing that fluid out. Then I would tell them that if you cough something up, I will have something for you to spit in, and that is ultimately what we want from this. It is also important for you to learn new ways to get in and out of bed and to move around in the bed to ensure that a reopening of your wound from surgery will not reopen. Throughout the entire treatment, I will be watching your vital signs to make sure you stay within good limits. We may try some walking if you are able, but if not, that's completely fine. If you are able to walk, I will be beside you the entire time for any reason. It's always good to ensure the patient on what you're doing beforehand because you don't want to get in the middle of something and the patient wig out. So it's very important that you let the patient know that their safety comes first. You explain the entire procedure to them before you move on with it. So just always make sure the patient knows what you're going to do and make sure they know that it seems like you know what you're talking about. And that is it. Thank you so much.